Good afternoon. I'm Pennsylvania Attorney General Josh Shapiro, and I'm sorry that I can't be with you today due to a family commitment, but I want to thank Judge Duffy and the Drug Addiction Resource Alliance for allowing me to share some thoughts with you. Before I go any further, I want to take a moment to recognize and appreciate Judge Duffy and the good work that she does. Her work exemplifies the leadership we need from all of our public officials. She's seen the epidemic firsthand, visiting Kensington in Philadelphia, where she witnessed children neglected by parents who were suffering from addiction, watching people injecting heroin to stave off withdrawal, observed as police crack down on those who profit off these poisons, and seen how quickly one street-level dealer gets replaced with another. She then brings her experiences to this courtroom, where she goes the extra mile to help those appearing before her access the treatment that they so desperately need. I don't need to tell any of you how bad this crisis is. According to the CDC, Pennsylvania is averaging over 5,400 overdose deaths per year. 15 Pennsylvanians die every day from this epidemic, and it is only getting worse. The number of emergency room visits for fatal overdoses has increased 81% from 2016 to 17. The opioid crisis affects every community: black, white, brown, rich, poor, young, old, urban, suburban, rural, male, or female. It is our number one public health crisis and our number one public safety crisis, and my top priority as your Attorney General. If we hope to slow this epidemic and start saving more lives than we lose, it's going to take a multidisciplinary approach. Prevention, enforcement, and treatment are all vital components. Without all of them, none can succeed. While I'm not interested in replicating the war on drugs, I know that we cannot back down from enforcement. We cannot tolerate people who seek to profit off pain and death in our communities by selling heroin, fentanyl, and carfentanil. My office is relentless in pursuing high-level drug dealers and bringing them to justice. Last year, we arrested over 1,700 dealers. That's an average of 5 dealers a day. We charged 10 individuals with drug delivery resulting in death for selling drugs that killed Pennsylvanians. We also cracked down on doctors, pharmacists, and others who divert legal prescription opioids to the black market for profit. In fact, we increased these diversion arrests by 72% last year, including 2 doctors just this week. But I know we can't arrest our way out of this crisis. Addiction is a disease, not a crime. And if we hope to make an impact, we have to address the root cause: prescription opioids. We can prevent addiction by reducing overprescription and oversupply. After all, drug dealers are only one part of the supply chain. For many, addiction starts with a legal prescription drug from a doctor. In fact, 4 out of every 5 heroin users start with prescription drugs. The simple truth is that America is flooded with opioids. Our doctors write upwards of 300 million opioid prescriptions every year. We as a nation consume 80% of the world's opioids, despite only having 5% of the world's population. Thankfully, we're starting to see a decrease. Prescriptions were down 12% in Pennsylvania last year. That will have an impact, but there's still far too many being prescribed. That's why I'm leading a nationwide, bipartisan, multi-state investigation into 6 opioid manufacturers and 3 opioid drug distributors. If I find that these companies engaged in misleading or deceptive marketing practices or turned a blind eye to diversion, I will bring them to justice. My goals are to make these companies pay for any damage that their drugs and their behavior caused, and to recover financially for the people of Pennsylvania, and most importantly, to change corporate behavior by showing companies everywhere that these types of practices will not be tolerated. If they helped cause this problem, they better be part of the solution. Prevention is another important component of our strategy, and it starts right here at home, where too many people are first confronted with the pathway to addiction. 70% of those who misuse prescription opioids get them from their friends or relatives' medicine cabinets. 60% of us who are prescribed opioids by a doctor end up with leftover pills, extra pills, which sit in our homes, waiting for someone to find them, take them, and ultimately to become addicted to them. We must get these dangerous pills out of our medicine cabinets and out of our communities. That's why my office operates a statewide drug disposal initiative. By relying on nearly 700 prescription drug drop boxes across the Commonwealth and right here in our area, we destroyed over 43 tons of prescription drugs last year, a 65% increase over the year before. For areas that are underserved by these boxes, we created an initiative to distribute 300,000 safe drug disposal pouches to pharmacies and palliative care facilities in 17 counties across Pennsylvania. Together, these pouches can eliminate 1.35 million pills without harming the environment. For the thousands of Pennsylvanians already suffering from addiction, we must do a better job with treatment. Helping people achieve recovery will save lives and reduce demand for illegal drugs. I've stood in front of major insurers in this Commonwealth and demanded that they do more to cover treatment and expand treatment options. I'm also leading a bipartisan coalition of 39 attorneys general demanding that Congress abolish a ridiculous old Medicaid rule known as the IMD exclusion, which actually prevents treatment facilities with more than 16 beds from receiving Medicaid reimbursement. You know, Scripture teaches us that no one is required to complete the task, but neither are we free to refrain from it. We've already lost far too many lives to heroin and opioid addiction. Now is the time for each of us to do our part. Now is the time for action. And I know that all of you are doing your part, especially Judge Duffy. I want to thank her and DARA for all of your hard work. I'm proud to stand shoulder to shoulder with you as we try to combat this epidemic and save lives. Again, I'm sorry I couldn't be with you in person today, but I thank you for being here and I thank you for your important work.